So, hello everyone. Hello. Good afternoon, everyone. So, we are coming to a very, very important session, the FMG recall. Hello, everyone. So, how was your paper? Paper कैसा था? Easy, moderate, थोड़ा tough. How was your paper? Yes. Okay. Okay, chalo. So, we can start now. So, how many questions came from the FMT exam? FMT. Anyone? How many? Mixed, moderate, good. कितना क्वेश्चन आया था फोरेंसिक मेडिसिन से? Anyone? Purvan Patel is saying it's very easy. Okay, nice. FMT से कितने क्वेश्चन आए थे? How many questions from forensic medicine? बहुत easy. हेलो तौफिक, कितने क्वेश्चन आए थे एफएमटी से? Did a silly mistake. चलो कोई बात नहीं. We can start now one by one. So the first question, which is very, very simple: who conduct the inquest in police custodial death? Anyone? Very simple question. Police custodial death. You just see the police custodial death. Okay. Higher police official, judicial magistrate, medical examiner, coroner. Yes, it's very simple question. It is judicial magistrate. Police custodial death. Hello everyone. Hello. It is judicial magistrate. Yes, the answer is B. As you can see, I discussed all the questions directly from notes. The police inquest is the most common inquest in India. In all death, we go for police inquest. Yes. Doesn't matter. In police custodial death, it was judicial magistrate. Executive magistrate आएगा तो भी आपका judicial magistrate ही होगा. Okay. And magistrate conduct the inquest in 6 death. Magistrate conduct the inquest in 6 death. You can see the most common inquest in India is police inquest. These all are given in PrepLadder notes. The most common, the minimum level is senior head constable, and it is done in unnatural death. It is done in unnatural death. Okay. Magistrate inquest is done in mental asylum. A. Police beating. B. C. Police custody. D. Dowry death. E. Exhumation. F. Police firing. And as I told you, the police related death, it is judicial magistrate. Yes, done, sir. Very easy question. Second question, ध्यान से देखना. As per latest MTP Act, termination of, yes, as you can see, according to latest MTP Act, termination of failed contraception is allowed till what week of the contraception? Yes, anyone? 20 weeks, 24 weeks, 12 weeks, 28 weeks. Very simple question. And I discussed this many times in LRR and everything. Yes, it is 20 weeks. So this is few important point of MTP Act. It was implemented in 1971. There was amendment in 2021, and these are the indication. These are the indication. Consent always required from mother. Confidentiality if we breach, yes, it is 1 year punishment plus minus fine. Up to 20 weeks, one doctor. 20 to 24 weeks, two doctors. Very simple. है ना, बिल्कुल बेसिक चीजें पूछी गई थी. Now this is the point which they are asking. Up to 20 weeks, that's a contraceptive failure. Yes, IPC learn नहीं करनी बेटा भी. Up to 20 weeks contraceptive failure, and up to 24 weeks in these cases pregnancy, rape, incest, vulnerable female. After 24 weeks we need to make medical board with substantial fetal abnormality, and this medical board is by 4 people. One is gynecologist, second is pediatrician, third is radiologist or sonologist, fourth is any other member who is a gazetted officer, and any time to save the life of pregnant woman. Okay, and this is the qualification required for MTP. These all are mentioned in PrepLadder notes in a very simple way. Okay, done, sir. Very simple question. Sir, if a family died in the closed room which was full of smoke from wood fire, which of the following findings seen in the postmortem examination? The question is asked about the postmortem examination. And it's a very simple case of carbon monoxide poisoning. That is suffocation. Yes. So it's a very simple, very simple cherry red postmortem staining due to carbon monoxide. This is the best answer. This is the best answer. Yes, cyanosis can be seen as asphyxial sign, but the characteristic finding of postmortem finding of carbon monoxide poisoning is cherry red postmortem staining, hypostasis. Yes, done. Third question. बहुत easy है बेटा. Postmortem finding of this carbon monoxide poisoning, as I told you, cherry red color, the blister on dependent part, and bilateral symmetrical necrosis and cavitation of globus pallidus and putamen. This question can be asked in winter mention होगा, doesn't matter, winter mention हो, summer mention हो, कोई mention नहीं होता. It is a clear cut case of carbon monoxide poisoning. Okay बेटा? Aditi, you got my point? Yes. Done. Okay. A case of accidental burn injury in a female patient aged 25 years. अब दोस्तों इसमें ध्यान से देखना, right upper limb, entire right lower limb, entire front and back of the abdomen. Forensic was really scoring subject. ये हमेशा कहता हूं बेटा, मैं क्या बोलता हूं, forensic is a small subject but it covers 12 to 13 marks which we can get correct. Yes, right upper limb it's a 9, right entire lower limb it is 18, and entire front and back of the abdomen that is 9 plus 9. Very simple, doesn't matter. Okay, so it is 45% according to the question which is given by the student. Yes, I'll come to that point, don't worry. Okay, but this is 45% and this I discussed in the class. Actually देखो दोस्तों, these all notes are given in the PrepLadder in the same manner which I am talking. I have used all the slides, sir. I have used all the slides. हाँ देखो, if देखो मेरी बात ध्यान से सुनो, listen very carefully. If it is given right upper limb 9, entire right lower limb 18, entire front and back 9 plus 9, this is rule of 9, Wallace rule. हाँ, अगर lower limb नहीं दिया हुआ हो, then it will be 9 plus 9 plus 9, that will be 27, but I don't think that 27 was given in option. है ना? Doesn't matter. What I am telling you, just see the concept. If you know the concept, upper limb is given 9%, entire right lower limb is given, this is 18, and entire front and back of the abdomen, it is 9 plus 9. And also you can see, this is rule of 9. That is head and neck 9, upper limb right 9, left 9. हाँ बेटा, कोई बात नहीं. Chest 9 plus 9, abdomen 9 plus 9, and lower limb, right lower limb 9 plus 9. Yes, and left. मैं क्या बोल रहा हूँ दोस्तों, आप तो कह रहे हो सर कि ये दिया हुआ ये नहीं दिया. I am telling you the concept here. This head and neck is 9, right upper limb 9, left upper limb is 9, जो भी दिया हो. Chest anterior 9, posterior 9, abdomen anterior 9, posterior 9, lower limb right lower limb it is 18, left lower limb it is 18. आपको इतना ही याद रखना. Okay, and if you want to go in further detail, you just remember this formula also. Yes, आपको ये देखना कि क्या पूछा गया. Whatever is asked, just see that whatever asked. अब 36% भी हो सकता, 45% भी हो सकता, but this is just you have to see this formula. This is rule of 9. अब ये कह रहे हैं सर अपर लिम्ब चेस्ट और एब्डोमेन दिया हुआ था, कोई बात नहीं, आपने दिया हुआ तो आपका सही होगा. Whatever is given, you just calculate by this method. Whatever is given, you just calculate by this method. है ना? अपने को इस डिटेल में नहीं जाना कि क्या दिया हुआ था या क्या नहीं दिया हुआ था, बट आपने तो देखा ना what was given there, है ना बेटा? लोअर लिम्ब व्हाट नॉट देयर, बायलेटरल अपर लिम्ब चेस्ट और एब्डोमेन. ठीक है, बायलेटरल अपर लिम्ब हो गया तो 9 plus 9 दैट इज 18. ठीक है, चेस्ट और एब्डोमेन अपर पार्ट इज गिवन, मतलब इंटीरियर पार्ट इज गिवन 9 plus 9 दैट विल बी 9 plus 9. आर यू गेटिंग माय पॉइंट और नॉट? सो जस्ट सी दैट. ओके, अरे समझ में आ गया मेरे प्यारे दोस्तों? आर यू गेटिंग माय पॉइंट? व्हाटएवर इज गिवन यू हैव टू कैलकुलेट बाय दिस पर्टिकुलर फॉर्मूला. चलो, है ना? कम टू दैट पॉइंट. So this is very important. Just इसका स्क्रीनशॉट ले लेना. Just take the screenshot of this. This would be sufficient. है ना? आपको ये नहीं देखना सर किया. और ये जो स्लाइड है ना, this slide is very important. इसका पक्का स्क्रीनशॉट ले लो अगर फर्दर डिवीजन दे दिया जाए. Yes. Sir, a chronic alcohol came with the complaint of global confusion, disorientation, hallucination, fever, hypertension. Sir, these all are after cessation of alcohol since 48 hours. So this is a very important point. So this is without any doubt, it's a delirium tremens. It is delirium tremens. And also this slide I discussed in the PrepLadder notes. After 6 to 8 hours, tremor, hallucination after 12 hours, yes, seizures, delirium tremens is seen in 2 to 3 days. और मैंने इसकी ट्रिक भी बताई थी, D2 T3. Delirium tremens after 2 to 3 days. And also I told you that you can see confused. देखो every line is written confused. Autonomic activities increase, heart rate, BP, and everything is increased. Tremors are there, hallucination are there, visual. So here answer will be very simple. Here answer will be delirium tremens. Here answer will be delirium tremens. तो इसमें गलती नहीं करना है. Are you getting my point? एक एक लाइन आपको ध्यान रखनी है. और मैं क्या बोल रहा हूं, all सारे all question directly came from the notes. कहीं पे भी ट्विस्ट नहीं है. This is very simple one. Anyone? Yes, this is very simple one. कितनी बार बताया? हाँ, ऑप्शन समथिंग लाइक एल्कोहलिक डिलीरियम डजंट मैटर. यस सी अखिल अंकुर मेहता कह रहा है कि सर एल्कोहलिक डिलीरियम दे सकता है, बट डिलीरियम ट्रेमेंस इज द आंसर. यस, दिस इज विदाउट एनी डाउट इट इज टेकन ऑयल. ए पोस्टमार्टम चेंज. और सर देखो सेम की सेम इमेजेस. व्हाट इज टेकन ऑयल? T4 taken oil 3 to 6 hours. It is mainly seen in open eyes. It is because of cell debris plus mucus. Generally it is yellow color, then it becomes brown and black. Very simple. And every simple line, it's a very important criteria for time death. देखो, why I am posting the images also, because same मैंने आपको notes में पढ़ाया था. Are you getting my point? Same. कोई भी किंतु परंतु नहीं है. Same I discussed in the notes. चलो, ठीक है बेटा, चलो आगे. Conjunctivitis red spot. ऑप्शन बहुत easy थे, ये कह रहा. Look, sir, this is very simple question. At the time of commission the offense, the person was having unsound mind and he didn't know the nature and consequence of the act. Doctor sir, anyone who can tell me what was that rule? देखो डॉक्टर साहब, here highlighted point is unsound mind. Unsound mind आते ही तो आपके दिमाग में कुछ आना चाहिए. And he didn't know the nature and consequence of the act. हाँ, अब बताओ. Yes, didn't know the nature and act or consequence of the act. Without any doubt, it is Macnaghten's rule. It is Macnaghten rule. और अच्छा, प्रीत पटेल कह रहा है ये नहीं था बेटा, क्या था? No question. This was not a question. What was that question? Anyone? What was that question? Anyone? It was not there. No such question. The question was not there. Lucid interval was asked. They didn't ask this question. Okay. Question क्या था? Question क्या था? Anyone who can tell me what was the question? I think that if the lucid interval is asked, then unconscious, then conscious, then unconscious. If they ask this question, the answer will be lucid interval. Is it? ये था क्या बेटा? Tell me dear. ये भी नहीं था. Unconscious, conscious और unconscious. Anyone? तो क्या था? I think the question was there regarding the Macnaghten, Durham's, Curran's or irresistible impulse test. Anyone? Brain trauma, blood cannot be washed with water during autopsy. अच्छा, blood cannot be washed during autopsy. If brain trauma, blood cannot be, there was no question regarding any rule. Okay. अच्छा, नहीं आप ये कह रहे हो Macnaghten, Durham's, Curran's और irresistible impulse test था ही नहीं. चलो, I will cross this. If this question was not there, I will cross this. ठीक है? बोलो. कर दूं क्रॉस? चलो आगे. हाँ, चलो. ये मैडम कह रही है, दे आर आस्किंग कि ब्रेन में which hemorrhage is not washed. This is also from directly from notes. Which hemorrhage is not washed away during autopsy? Doctor, I'll come to that 2 point. One is subdural hemorrhage, another is subarachnoid hemorrhage. Doctor, which is not washed? The answer will be subarachnoid hemorrhage. Subdural can be washed. Yes. No, EDH can be washed because EDH is above dura. EDH is above dura. And that doesn't matter. That answer will be judicial magistrate. Now, if the question is from brain which is not washed, it will be subarachnoid hemorrhage because subarachnoid is deep. Subdural we can wash out because it's very superficial. Yes. So are you getting my point? If you get this question, the answer will be this. I cross or I mark it cross if this question was not there. Done, sir? चलो आगे. Yes, got correct. छोटा डॉक्टर का करेक्ट हो गया. That is subarachnoid hemorrhage. चलो आगे. बोलो बोलो. ये तो क्वेश्चन था. In brain, the hemorrhage which is not washed. Okay. नहीं, it can't be subdural. It is subarachnoid. It's a deep one. Subdural, when we dissect the subdural, it will, when we remove the dura, it will be washed out. But subarachnoid is not washed out. Okay. So if you got this question, that is okay. So these are the rule. No need to discuss this rule now because you are telling, sir, these were not as a question. ये question था ही नहीं. Yes. Identify, actually here in this question, the history was given and they asked the question, that what is the finding of antemortem drowning. Okay, this is a very simple short question. It was cadaveric spasm. It was a cadaveric spasm. Okay, इसमें हिस्ट्री दी हुई थी, द पर्सन इज इन वाटर, ही वाज टेकन. यस, अच्छा ये कह रहे हो ये भी क्वेश्चन ही था. देयर वाज नो क्वेश्चन ऑफ द ड्राउनिंग. नो ड्राउनिंग क्वेश्चन. पक्का? हाँ वो तो आ जाएगा, वो तो आ जाएगा. देयर वाज अ डिकम्पोज बॉडी, आर्सेनिक एकोनाइट, दिस. सो चलो, लीव इट अवे. You are telling there was no question, but students told me this question was there. Okay, done. चलो आगे चलो. ये तो था बेटा, देयर वाज द हेमाटोमा, डिफेंस वुंड का था. anyone who can frame the question of defense wound? Anyone tell me, dear? Anyone who can frame the question of defense wound? Anyone? If this was a question, there are few people they are saying this was a question. If this was a question, the best criteria for antemortem drowning is cadaveric spasm. Anyone? अच्छा, picture was given. Tawfiq is saying picture was given. Which picture was given? क्या था picture में Tawfiq? अच्छा, the people are saying there was no defense wound question. Cadaveric spasm was there. Rashish Memon is saying cadaveric spasm was there. Anyways, if the question of the antemortem drowning is asked, the answer would be cadaveric spasm. The picture was not given. Okay, defense wound. Anyone who can frame the question of defense wound? Anyone who can give me the answer? अरे बेटा उस क्वेश्चन पे आ जाएंगे, which will normally present in human body, वो छोड़ दो. Okay, चलो, if this was a question, there was the answer is cadaveric spasm. ठीक है, anyone who can tell me the question of defense wound? Vegetable vendor, मेरे पास क्वेश्चन आ जाएगा medical plus, I'll get that question. I will be on forearm and hand. अच्छा, there was a question on the forearm and hand. There was a question that was a defense wound without any doubt. If that question was there. Okay, so if there is a wound on the palmar surface, it is an active defense wound, and if there is a wound on extensor surface, this would be passive defense wound. Okay, अच्छा आप तो कह रहे हो defense wound भी question नहीं था, but again I am telling you, if you have defense wound, if you have the cut on the palmar surface, it was active, and if on the extensor surface, it will be passive defense wound. Okay, doesn't matter, sir. Chalo. There was a question of the extradural hemorrhage, and without any doubt, there was an option of middle meningeal artery. Yes, middle meningeal artery का question था. Yes, anyone? कि ये भी नहीं था. अरे बेटा वो वेजिटेबल वेंडर वाला आ जाएगा, डोंट वरी. अच्छा ये भी नहीं था मिडिल मेनिंजियल आर्टरी, एक्स्ट्राड्यूरल हेमरेज. अरे वेजिटेबल वेंडर वाला तो आ जाएगा. Okay, no question on this. The answer is middle meningeal artery if there is this one. Okay, done. ये question, there was a patient admitted on the tachycardia and tachyarrhythmia. Yes, yes. Examination, multiple scratches mark were present over the body. ये तो था, मेरे को मालूम, ये 5-6 बच्चों ने पूछा था. हाँ ये तो पक्का था. There is a tachyarrhythmia and tachycardia. Yes, that is multiple scratches mark present over the body. That is cocaine poisoning. Without any doubt ये question था. यस यस यस. अरे एडवांस बॉडी डिकम्पोजिशन बेस्ट मेंशन वो आ जाएगा बेटा. मेरे को लगता है बेटा आपको याद नहीं है, क्योंकि हाँ कोकेन वाज नॉट इन ऑप्शन. अच्छा ये क्वेश्चन नहीं था, बट अगर ये क्वेश्चन था तो द आंसर विल बी टैकीकार्डिया एंड एरिथमिया. इट इज अ सिम्पैथोमाइमेटिक. द आंसर विल बी कोकीन. ओके, आप कह रहे हो कोकेन ऑप्शन में नहीं था. ऐसी हिस्ट्री नहीं थी. हिस्ट्री क्या थी? व्हाट वाज द हिस्ट्री? हिस्ट्री बोलो, टेल मी, बोलो हिस्ट्री बोलो. अरे टेकन ओवर तो हो गया बेटा. अच्छा क्वेश्चन वाज देयर बट कोकेन वाज नॉट इन ऑप्शन, है ना? एनी अदर टेल मी डियर. Tachycardia and tachyarrhythmia. In burn patient there was no lower limb. Okay, done. History is same. If history is same, the answer will be cocaine. अगर आप कह रहे हो कि अगर cocaine नहीं जाता है, अच्छा strychnine was in option. There was an option strychnine. Sir, in the question was in which solution we kept the specimen, so case of poisoning due to long time kept me in that solution. अच्छा, तो क्या ऑप्शन थे इसमें? द क्वेश्चन वाज, उसमें क्या ऑप्शन थे? थ्रॉन प्रिक था, स्ट्रिक्नीन पॉइजनिंग, अच्छा, insect worm like feeling in hallucination. If insect feeling like hallucination, अच्छा, there was a neuro poisoning. They are saying there are the symptom of neuro poisoning, and the option was given strychnine. Yes. No, strychnine question was different from some farmer had thorn prick injury. Friends, thorn prick injury, facial spasm and spasm of trunk and limbs. If it's a thorn prick injury with facial spasm, the answer will be strychnine. Yes. If this was a question, the answer was strychnine. Yes. Strychnine was from microbiology. But if there is a thorn prick injury with facial spasm with opisthotonus, pleurostotonus, the answer will be strychnine. Yes, the patient died. The next question you can go for this. This is cocaine. These are the method of cocaine poisoning. Now, this was a very simple question. This was a very simple question. The fear from height, a very simple question. It's acrophobia. It is acrophobia. The fear from height, we can remember by acromegaly. That's a more height. Yes, it is acrophobia. Abhi aa jate beta. If the tetanus symptoms are given, if opisthotonus, these are given, trismus is given, the answer will be strychnine poisoning. Okay. Which is contraindicated in gastric lavage? That is strychnine. Strychnine is a corrosive poison. Strychnine causes convulsion. That's why it is contraindicated in gastric lavage. Okay. Dono थे. Yes, strychnine. Chalo done. So this is acrophobia. Very simple question. I have discussed this is agoraphobia is public in crowded places. Yes, the claustrophobia from closed space, acrophobia height, night for nyctophorum night, meso from germs, hydro from water, glosso, it is phobia from public speaking. Trypano, it is from needle injection, arachnophobia by spider, nomophobia, no mobile, that is no mobile phobia, thanatophobia. Gastric lavage में contraindication, that's a strychnine. It is in strychnine poisoning, gastric lavage is contraindicated. If you get a question, gastric lavage we don't do in strychnine. The reason is very simple, because strychnine causes convulsion. It's a convulsion. Yes, done. Chalo. So, Dr. Saab, this is very simple question. ये तो था a vegetable vendor with no criminal background, 1 week found dead body in advanced decomposition. What would you do to recognize the dead body? Anyone? Yes. Relative contraindication, hydrocarbon. Hydrocarbon is relative contraindication. Yes. Patient cannot recognize face, know something were. It is very simple, yaar. It's a advanced decomposition. Why are you going for C, dental record? Uska dental record ka hum kya karenge? It's very simple. If we want to identify the person, we'll take the DNA and we'll compare with some. Yes, it's a DNA. In decomposed body, we can take DNA. Dental record, how would you do? DNA. The best method for identification is DNA. But if we know that he is a criminal and that we want to compare with criminal identity, then answer will be fingerprinting. Okay, but it is no criminal record. We want to identify the person. We'll take the sample for DNA analysis. Yes, B is the right answer. And I think this was a question. Who is the father of DNA? That's Alex Jeffrey. This was a question. Tell me. A patient died suddenly whose family is abroad. ये बताना बेटा, ये question मेरे को tricky लग रहा है. A preservative was used to preserve his viscera. Which of the following poisoning is seen in it? पहले ये बताओ. Is there any change in the question? Is there any change in the question? No. How would you identify the person? There is no one to compare. You will preserve the viscera and you will preserve the viscera for DNA. No, Alex Jeffrey, I'm not telling Alex Jeffrey. I want to tell you the best method in decomposed body will put the sample for DNA. We'll put the sample for DNA. Okay. Because the body is decomposed. अब ये बताओ. Liver is preserved in which solution? There was a question. He is asking that liver is a viscera. It is preserved. The ideal is rectified spirit. And most commonly used is sodium chloride. If rectified spirit is given, the answer will be rectified spirit. Okay. Unknown poisoning with 1 hour, also a gastric lavage contraindication. I told you that if corrosive is there, that's the absolute contraindication. corrosive. Absolute contraindication is corrosive, but relative contraindication is a convulsion, coma, hydrocarbon, all are there. If corrosive is given as a gastric lavage contraindication, the best answer will be corrosive. But if corrosive is not given, then convulsant C, then comatose patient another C, hydrocarbon another C. But best contraindication is corrosive. Okay. Sir, question was that found in decomposed body. अरे बेटा तुम तो सारा मिक्स कर रहे हो. In decomposed body, what is found? Arsenic, alcohol, aconite, morphine. ये क्वेश्चन था या नहीं था? Person died suddenly whose family is abroad. Preservative was to preserve his visa. Which of the following poisoning is seen in that? Acha, preservative was not given in that. Okay. Which of the following poisoning they asked? Preservative was not given. Which of the following poisoning was asked? Yes. Yes. ठीक है. Anyone who can tell me what is the sudden cause of death? If you want to go for mini poison, here the best answer will be aconite, because aconite is a cardiac poison. Yes, aconite is a cardiac poison because it causes sudden death. Okay, and if aconite is not given in option, then the second answer will be arsenic. It is commonly used as a homicidal poison. But I want to pick out of these four, the aconite is the best answer. Which not taken then also seen. Poisoning asked, which not taken then also seen. The contraindication of gastric lavage, iron tablet, hydrocarbon, 1 hour of unknown poisoning. नहीं, 1 hour of unknown poisoning तो नहीं होगा बेटा. Hydrocarbon. अगर strychnine होगा तो होगा. Aconite was given due to preservative. अरे यार मजे ले गए सब बच्चे. Sir, the question was he hasn't been poisoned and which is found in him. अच्छा ये कह रहा है कि उसको poison नहीं दिया गया था. He was not given poison and which is found in that. Anyone who can frame this question, a person died suddenly whose family is abroad. But first of all, tell me, preservative was given or not? सर यही क्वेश्चन था कि डेड बॉडी में पॉइजनिंग कौन सा दिखेगा जो उसने नहीं किया था. अच्छा, not taken any poison and seen, but what can come as a positive? अच्छा, okay. They are asking if they are asking the ideal homicidal poison which cannot be seen. Ideal homicidal poison. If they are asking ideal homicidal poison, like one. Yes, anyone? Aditya is right. Yes. If they are asking the which is cannot be seen, which is the ideal homicidal poison. Okay. No. They are asking like which cannot be seen in the postmortem. Now, ideal homicidal poison, I told you that is thallium. Okay. Was thallium in an option? Thallium option में था. हाँ, thallium option में था ideal homicidal poison. Anyone? सर मजे तो उसने लिए सर एनबी वालों ने. No, thallium was not in option. If thallium was not in option, then the second important homicidal poison is arsenic and aconite. Arsenic and aconite both were in option. In which poison tissue is preserved? A person died suddenly and body has to be preserved. Which among the following is found in the body which has not been taken any poison? The question was that which element will be seen in the dead body. Anyways, दोस्तों मैं आपको बता देता हूँ crystal clear things. If they are asking about the poison which is not been detected, thallium is given, thallium will be the answer. Thallium is not given, the arsenic or aconite will be the answer. Aconite and arsenic are very good answer. But if nothing is given, they asked about the sudden cause of death. The best answer will be aconite. Tarun said the exact question. Golgappa. Anyways, so actually, if the gastric lavage contraindication was asked, the best contraindication is corrosive. Yes. A person was alcoholic and उसका blood preservation करना था, which is preservative is to use. ये एक बच्चा एक नया question लेके आया. The person was alcoholic. The best preservative will be sodium fluoride. So sodium fluoride was there a question in alcoholic? In alcoholic, which was the best preservative? This question was asked. Anyone? What is the best preservative? Yes, anyone? ये बता दो बेटा. Tell me dear, was there is a question? Yes. For alcohol, like any kind of alcohol, the best preservative is sodium fluoride. The best preservative is sodium fluoride. चलो ये सबने इसमें यस कह दिया कि the best preservative for alcohol is sodium fluoride. ये पक्का है. ये क्वेश्चन था कि नॉर्मली क्या मिल सकता है. Which is the answer, sir, among arsenic and aconite? If they are asking the question, the better answer will be aconite. The better answer will be aconite. Sodium fluoride plus potassium. जमीन एकदम सही बोल दिया. Sodium fluoride plus potassium oxalate we can use. Yes. Preservation के बाद कौन सी poisoning दिखेगी if he is not poisoned? ये था. Next question नहीं है बेटा. Done. This is all about. This is aconite, and everything is done. So friends, only two controversy are here. The one is another question was person hit by car and which type of injury? That's a bumper fracture. Yes, you can get this question. The person was hit by car. It is the primary impact injury is bumper fracture. This is a fracture of tibia bone. Yes, this is a fracture. So I can add this one. This is bumper fracture. Bumper fracture. This was a fracture of tibia bone. Okay, this is primary impact injury. Yes, this someone told me this question came in exam. Fracture at shaft area was mentioned, so it's a bumper fracture. Yes, it is primary impact injury. Okay, so anyways, 2 or 3 controversies there. Okay, so I will mention in the chat box. Normally क्या मिल सकता उसकी बॉडी में. रिलेटिव इन अब्रोड एंड दे डिडंट मेंशन कि पॉइजनिंग है. उसके बाद लिखा था कि नॉर्मली क्या मिल सकता उसकी बॉडी में. नॉर्मली good book. Normally they asked what can be found normally. Normally they can found anyone morphine. Why morphine will be there normally? Anyone? Yes, what can be present normally? सब बोल रहे हैं ये क्वेश्चन था. चलो एनीवेज इसको एक बार मैं आपके चैट बॉक्स में आई विल मेंशन द क्वेश्चन एंड द आंसर, डोंट वरी. सो अभी एक बार इसको यही मान लेते हैं कि भाई विच इज आइडियल पॉइजन विच कैन नॉट बी डिटेक्टेड, द आंसर विल विथ हीलियम. इफ इट इज नॉट देयर, द एकोनाइट एंड आर्सेनिक आर द बेस्ट आंसर. एंड yes, aconite and arsenic are the best answer. Gastric lavage is contraindicated. Strychnine was there. It is a relative contraindication. Aconite, arsenic, alcohol, morphine was there in option for that question. Yes. Which solution postmortem organ we preserve? I already told you. For postmortem organ we preserve, the best solution is rectified spirit. If this is given in our option, rectified spirit, and if it is not given, then in India we used to preserve by sodium chloride. हो गया सर, सारे क्वेश्चन हो गए. डोंट वरी, 2 क्वेश्चन में कंफ्यूजन है. आप चैट बॉक्स में एक बार लिख लेना एंड मैं उसको एक बार देख के आई मेक इट करेक्ट. ओके, बट अगर ये है तो आपको थीलियम, आर्सेनिक और एकोनाइट में जाना. ठीक है. हाँ, टेटनस सिम्टम आई टोल्ड यू द स्ट्रिक्निन पॉइजनिंग. एक बाकी है, कौन सा? रेक्टिफाइड नहीं था, देन सेकंड आंसर विल बी, सेकंड ऑप्शन विल बी सोडियम क्लोराइड. सोडियम क्लोराइड. हाँ, if there is a cyanosis of lips, but it is not the best answer because the best answer will be cherry red discoloration. Okay. Okay. Anyways, best of luck for your result. आराम से आप सब पास हो जाओ और ज्यादा कंफ्यूज मत हो, सब अच्छा होगा. मोस्ट प्रोबेबली 99% चांसेस है आपके क्लियर होने के, क्योंकि फोरेंसिक वाज वेरी इजी, है ना. विसरा के लिए बेटा बेस्ट प्रिजर्वेटिव इज रेक्टिफाइड स्पिरिट. अगर वो नहीं दिया हुआ तो देन आंसर विल बी सोडियम क्लोराइड. ठीक है, चलो. एनीवेज, रेक्टिफाइड स्पिरिट इज ए 90% इथेनॉल. ओके, चलो, दिस इज ऑल अबाउट फॉर दिस सेशन. बेस्ट ऑफ लक, खुश रहना, बहुत अच्छा होगा. ठीक है दोस्तों, डन.